Hi everyone, welcome to Climb Your Everest Leadership Skills workshop. Today is our session 27 and we have Dr. Sima Khatri here. She's been my friend for the past 10, 11 years and I've known her since before she started studying and going to medical school. So thank you, Dr. Sima, for being here. She's going to be talking about women's health and sexual health for women. So I know this is a recording and I want everybody, whenever you have a question, you can raise your hand and ask your question from Dr. Sima because you can all benefit from this. And you guys can also type your questions in the chat box and at the end I can read the questions for Dr. Sima. So please don't be shy. These are important things. Though sometimes in the world it feels like we are not allowed to talk about our personal health as women or sexual health, like other people are not interested. They don't want to hear it. It is not a topic to be discussed in public, but it is very important. So everything you learn today, I want you to share it with your mom, with your aunts, with your grandma, with your sisters, all the female around you. We have access to Dr. Sima and I'm gonna share her email at the end. So if anybody has any questions, you can send all your questions to me and I can forward it to her or the other way around. But I want you to be able to stay healthy all the time and your family members. So that's the most important thing, right? An empowered woman is always healthy, right? And then if you have an issue, we go fix it, we take care of it. So please be open. Don't be shy. Ask your questions in the chat box. All right, let me, Dr. Simo, do you want to say something at the beginning before I share the slides? I see we have Eleanor here. So can you do the presentation in English?
Yeah, sure.
Yes,
Thank
thank
you so
you.
much, Dr. Sarah. It's my pleasure
Sure,
to
sorry, ma'am. Sorry to interrupt, but hearing so
Sorry?
not hearing properly. Sima sounds.
Oh, you cannot.
Okay, sorry. Okay, can you hear me now? Can you hear
Yeah,
me
yeah.
now?
It's okay now.
Yes.
Okay. Thank you so much, Dr. Sarah, ma'am, for this wonderful opportunity and making me part of this a very big and important program. It has been always my dream, to give back to the people from my country and people around the world in any way possible. And what else could be more, charming way rather than talking about the sexual health, which we usually shy away from talking about with our family or friends or within our community. So thank you so much once again for providing me this platform to share what I know and what I've learned in my medical school to my sisters, to mothers present here. Thank you so much. I will try to generalize this presentation in simple word as much as possible so that we can all understand the meaning. And during the process, if I use any medical term or the terms which are not familiar, please let me know in the chat box, or you can just raise your hand and ask me directly so that I can use, the simpler term. And if you since we do have guests from students and guests from India and other part of world as well, so whenever I'm explaining things, if you don't understand it, you can always ask me to uh, make it understand in Nepali language or even in Indian language. I'll try to generalize my idea as much as possible. Thank you so much.
Okay, great.
So is it okay if I start
Go ahead.
discussing about the idea, or is it all right?
Yeah, go ahead.
Okay, so great. So hello everyone. I am Sima Khatri. I'm doctor by profession, so I'm honored and happy to be part of this wonderful program. Today we'll be mainly discussing about the importance of sexual health for women. So if you say that in Nepali, it simply means Mahila harko lagi yon swasth, right? So this is one of the very intimate and private topic, mostly in the rural part of country, because we don't want to have much discussion about these things even with our mother or with our daughters or even with our female circle. But the importance of this sexual health is not just for women, but to the major community, including men's as well. So today we will since uh, the importance of this topic, it revolves around how it impact our day-to-day activities and how it has impact on our health. uh, so let me generalize it how what the sexual health mainly include. So can you switch to the next slide?
Yes. Um, okay. Sorry.
Okay, so whenever we talk about the term the sexual health, so it basically it doesn't only include the health of an individual, but it has a wider range, which includes the couple, which includes the couple, the health of an husband, the health of an wife, as well as the overall health of a family, which contribute to the well-being in the sexual health, and finally to the overall outcome, how it impacts on an individual health, right? So what are the mainly topic which can be included in sexual health? So next slide. If we mainly focus, okay, if we mainly focus upon the overall health of an individual, since today we are discussing about the female sexual health. So starting from the childhood till the end of an life of an female, so we do have a different phases. So it includes the overall health of an female, starting at the early period where we have our first menstruations, which we normally term as a period. Then later on getting married to our partners, and having the sexual relationship with them, and then after that a stage of our life, having a decision to bear a child within them during the time of pregnancy. And also apart from these physiological phenomenon of our life, the disease which are related, which can be transmitted during our sexual intercourse or any activities which are related to our sexuality, right? So these various topic are included into the in sexual health, right? So how an individual can determine whether that person is able to achieve the sexual health in optimum well-being or not. So there are different components which decide an individual is having or achieving the sexual health and well-being. It mainly, can you change the next slide? So it mainly depends upon how much qualitative information you do have regarding the sex and sexuality, right? How much you have a feasible approach to the idea and education regarding the sex, what does the sex means, and how and sexuality is affecting your life. So that will also determine whether you are having a healthy sexual life or not. So other point may include, next slide. So other point may include how much idea you have about the risk factor which you may face uh, when you are having an unprotected sexual activities, even that means before you get married or after you get married. So in context of Nepal or India or the South Asian country, usually having sex before the marriage is not considered as good. But that doesn't mean that it's not the same in other part of the world, like in the Western countries, and people are open about it and they talk about it. So but the idea is like how much knowledge you do have about the risk factor that you might face whenever you are being exposed to an unprotected sexual activities. So that will also determine the state of your sexual health, and also how much you are able to get access to the sexual, um, regarding your sexual health in your hospital or your primary healthcare center or any center which is available near to your home place. So how much these centers are providing education or your health treatment system, this will also determine about the state of your sexual health. And also the people who surrounds you, how much they are open to you regarding talking about any health issue, or trying to solve those problems, and trying to help you to get through that problem, is also one of the factor which will determine whether you do have a very good approach towards the female sexual activities or not, which in return help you to get a healthier life. Next slide. So if we see this term, the sexual health, it not only encompasses the sexuality of a person, but it can include a lot of things like the sexual orientation of people. So if you see like some people recognize themselves as a female, some recognize themselves as a male, whereas some recognize them as a mixture of the characters of both male and female. And the gender identity, how an individual identify themselves and how they express themselves sexually, and the relationship that they have with their partners, whether the partners are male, having a male partner or a female partner, and the pleasure that they get with their partner. So all of these things are included into the sexual health related issue. But the problem that we face as a female is like we are not able to openly vocalize our feelings. So if we are liking a male partner, or if we are liking a female partner, we are not being able to vocalize these things, and the pleasure that we get during our relationship with our partner, if it is not satisfactory because of the social constraint, we are not able to express. That's why we keep this feeling inside ourselves, which is also psychologically hampering the state of mind. That's why these things are also encompasses in the modern sexual health, which we as a youngster should be aware of, and we should have the knowledge about these things, and also share such things with our family members, with our mother, fathers, brothers, sister, and the people around us. Because if we haven't held a discussion about these feelings, about this expression, about this relationship, that's how it's gonna help us socially, as well as in terms of our psychological state of mind. So, in today's context, if we see mainly after the pandemic, next slide, please. So, mainly after pandemic, the various aspect of the health are being targeted by World Health Organization to create an healthy environment. So, among them, so this has been also a very major topic, not only in Asian country but in a lot of other Western as well as African country. Multiple stakeholder, um, they are conducting different programs and developing different tools in order to guide and support population in different countries, so they can cover as much as the idea and the concept of how this is important aspect of education, and how this need to be spread among the different people, different groups of people, and how it has been benefiting us. So this has been one of the very good and broad motto of World Health Organization as well. So why? So if we see why having an idea regarding the sexual health is very important. So it includes not only for the female, but it applies same for the male as well. So male group of population as well. So there are a lot of infectious disease which are transmitted sexually, or through the sexual mode, either having a relationship with your partner, or bearing a child, and through the pregnancy process, or a mother spreading the same disease to their children during breastfeeding period. So we most of us, we don't have idea about different diseases that have possibility to get transmitted, not only through the sexual intercourse, but also direct and indirect transmission. So when we say indirect transmission, it includes a mother transmitting the STD, which we call STI or STD, through breastfeeding, or through the blood transfusion. um, so infection, which includes like HIV, which is human immunodeficiency virus, or various other sexually transmitted infection, reproductive tract infections. So having idea about a proper and good sexual health also give us idea about what are the possible infection or disease that can be transmitted, so that we can be aware, right? So we can be aware during the process, because this sort of infection do have direct impact in the fertility of an individual, the fertility of male or the fertility of female. So when we say fertility, it indicates the capacity of a male or a female to bear a children, right? So if you have a female, that means the capacity to get pregnant, or if you have a male, that means the capacity to get the female pregnant, right? So when we lack the education about sexual health, we are lacking the information about the possible infections, and also the unintended pregnancy and abortion. So if we talk about in the context of Nepal or India, the South Asian country, getting pregnant before you are married is still a social taboo, and or even after getting married, if you are thinking about abortion, it's still a social taboo. But it's the health and the body of a female. So they, because of different disease or different medical condition, they might not be able to continue the pregnancy, or there might be a cases where you have to get your abortion done because it's not helping your body. So having an individual choice either to get pregnant or not continue the pregnancy uh, has been taken away from us in country which are still developing because of various social stigma. So when it comes to the female sexual health, if you know your body, right? So you know your body, and you know whether you are able to continue your pregnancy or not. So it's in your choice, provided that you are not harming anything else. So to take an independent decision and to make your health professional or your family member understand that how this is socially or psychologically affecting your state of health, and being able to take your sole decision, also get included under this segment of the education, right? And also, um, this education includes how to know when you are being sexually exploited by other group of populations. So most of the time we are not able to vocalize when our partner are trying to, you know, make an forceful intercourse. So we are not able to, you know, vocalize, just thinking what our family will say, what our society will say. but but have That's why having an education or knowledge about your sexual health is important, knowing that you do have a sexual right. Saying no when you are not feeling comfortable is also included in this segment of health. And in most of the African country, there's still a practice where there is female genital mutilation, having because they do follow certain religion and thinking that they will please their god. So this sort of harmful practice, which do have very adverse effect in the life of a female, in the further state of their body. So having a knowledge that what kind of right you have, and what are the thing which is against your body, will help you to raise your voice, saying no when you are not comfortable. So that's why this education is not only for certain age group of people. So this education, I think, should be started from a very early childhood stage, so that a girl can know what are the things that she need to consider when she is growing up, and what are the things she needs to know when her body is being changed, when she is getting married, or she's at a childbearing age, or she's having menstruations, what are the possible changes she might go through. So that's why from a very early stage of her life, especially the female, having this education is very important, and we should not shy away talking about this topic, right? So if we start from a very childhood ages, um, the first changes that we see in our body is which we call menarche. So this one is medical term. So menarche means the first time when you start your menstruation. So what we call it normally is our period. Um, so menarche normally starts from 13 to 50. So the importance of the spreading of importance of this kind of education is important before you reach this 13 years or 14 years, so that you can know what the changes are happening inside your body, so that you can take your children to nearest hospital or the center where they provide a very good education about your bodily changes. So menarche, if a girl is going through her menarche or the period or menstruations, it's not the just blood coming out of your vagina, right? So there are other body changes which she may experience. It includes growing the size of your breast, or increase in or growth in the hair of your private organs like pubic hairs or hair under your armpit. So most of the children's or the female of this age, they might not identify themselves in those certain stage of their life. They might panic, and they might have altered in the thought because their body is changing. So that's why having an educations, or at least visiting your nearest health center, so that that population, that group of population can identify the changes that their body is going through, and not panic about the changes, right? So visiting this kind of health center at early stage of life, it also help in risk assessment, and also give an idea about the menstrual health, and also any kind of counseling that the girl of that age group might need. So when your body is going through menarche, when you are menstruating, um, you'd have in cities or most of the places, you'd have facilities of using sanitary pads, which is an hygienic approach, but it's not the same cases in other rural parts of our country or in most of the world, right? So that doesn't mean that you should devote your health away from a very good sanitary approach to your menstruation. So the alternative education which might be provided in your health center, or any such programs like using the tidy clothes which are made out of cottons, or having change your undergarment daily, or using any clean piece of cloth which can prevent you from infections, might be also another approach to replace sanitary pads. So the knowledge of having how to use such sanitary pads, and how much bleeding is happening in every periods of your in every periods, like for example, it will all depend upon your body. So some people needs to change 2 to 3 sanitary pad every day during their menstruation period cycle, and ranging from 4 to 5 in other women. So but if you are having certain increase in the number of pad you are using in every month or cycle, you should also be aware that is it normal, am I using the normal range of pad this month, and am I using the extra number of pad the next month. So that means if you are bleeding heavily, that means something is not going well inside your body, right? So so uh, having an approach to a health center when you are bleeding more, or if you are bleeding less, or if you are having pain during your menstrual cycle, the excessive pain, much more than you can bear, then seeking the idea of seeking your nearest health center is also provided through the sexual health education. But in most of the cases we don't visit other nearest health center thinking that it's not okay to talk about such issue, which is not true, right? So this idea, if you have this kind of idea, either you can share this thing with your family, or you can share this thing with your friends, or a mother can teach the same thing to their daughter, or the daughter can share this with their sister, or any circle, social circle. Can you change the next slide? um and the next one, next, next. Okay, the next one. So okay, so the monarchy that we are talking about, so this is also the group, the teen. Usually this is the teenager group of population. So they are influenced because of the hormonal changes that is going through their body. So it is also influencing their action, right? So having a healthy choice of not getting engaged in any risky behavior just because you want to please your bird, or a group of friends or circle and gain their acceptance. So making those group of population understand that whatever the changes their body is going through, it's all because of hormone, that is nothing um, so harmful that is going inside your body. It's just a normal physiological process, can also assure those group of population and prevent them from taking any harmful steps, right? And also before starting talking about the menstruation or the period, we can also learn about how your body works, how our body are expected to change physically and emotionally is important, which is provided when you have an approach to the sexual health. So a lot of schools and college, they do have this book called health, which provided information about the changes that is going through our body in different parts of our body, which is must. And especially when teachers are explaining to the students about this particular topic, they should not shy away, and they should be more open, so that the student can also learn that it is very normal to talk about this topic, so that they can go out of the school, that they can talk the same with their family, with their society, with the people around their community. So we can have a very open discussion about such topic and prevent any further risks that could happen in the further stage of our life, right? So once your menarche started, you have an idea about how what is period, how what are the changes that you are expected to have during starting of your period, right? And when next slide please. And during the menstruation also, when we have problem like heavily bleeding or any irregular bleeding, or you are having the excessive cramps and pain, it is very important to have an expert opinion. Go to your gynecologist, go to your nearest doctor available, and seek for help. Don't feel shy to discuss about your problem. Feel free, ask your doctor or gynecologist what are the thing you are facing, so that you get in proper health treatment from the specific person. So during this process, you might feel a little bit awkward at the beginning, but the more you talk about your body, the more you will be open to the new knowledge about how you can get help, how you can get accurate
On Christmas?
information.
On Christmas day ni? Huh?
I think I'm getting some voices from the background. Is it just me hearing this or okay?
I think
Hello?
someone talking. Arvin, please keep yourself mute. Okay, thank you.
Okay, thank you. So yeah, so you can have accurate information about the sex, and instead of you turning away from such knowledge, you can teach such things to your family members. So next stage of your life is regarding the pregnancy. So having an idea how the pregnancy stage of your life function, because it's just a physiological process, it's a very natural process. And regarding the pregnancy, uh, so what are the frequent number of time you need to visit your doctor during your pregnancy time, which you consider as antenatal checkup. So you should have an idea, so there must be at least
Dia tak
minimum
concern ni.
four
Jesus like.
um, so there must be minimum 4 time visit to your gynecologist, that is considered by WHO. But there should be at least around 8 number of visit during your pregnancy time to your gynecologist to get open about the nutritions, what are the medications like folic acid, iron that you need to take to in order to prevent any congenital abnormalities to your babies and to prevent heavy bleeding during your delivery period. So these are, and also even after delivering your babies, what are the procedure you need to follow, or what are the food habit that you need to follow, what are the other caring system which we call postnatal care that you need to follow in order to avoid the post pregnancy or post delivery complications, right? So these are the things which you should consider during your pregnancy. But apart from that, so if you are trying to avoid your pregnancy, what are the options that you might have? uh, so it may includes birth control pills. So this is considered one of the easiest option in order to control or your pregnancy or use as a contraceptive method, because it just taking a pills and having it every day on exact same time every day, right? But these are not a very good choice if you are considering the longer time contraceptive um, method, because it might have certain adverse effect to your body, like gaining weight or having irregular periods, or hormonal changes. So if you are thinking about any long term acting contraceptive device, we do have other options like IUCD, couple T. So these are the contraceptive method which will have an effect for the longer period of time and having a very minimal side effect, right? So, and also if you are planning to uh, get pregnant or have babies, you can always have this safely removed at your nearest health center, and you can have your normal pregnancy level back. but but apart from this, if you are having next slide please. But apart from this, if by any chance there is unplanned sex, and any other method of contraception fails, then there is also this thing which is called in emergency contraceptions, which should be taken within 72 hours of unprotected sex. um, and mainly in our country it is available if you are over 18 years, and but the prescription if needed can be also provided for 17 years old female. And if we use this, it is 89% effective at preventing pregnancy, but it should be taken correctly, right? um, So it can also prevent future pregnancy if you plan to being sexually active. But also another emergency contraceptive pills could be like, if you have an unprotected sexual intercourse, you can have a pill within 72 hours. But also you can have IUD, that is intrauterine device, within 7 days of unprotected sex. So this can also prevent having unwanted pregnancy. So it can be also proven as a very effective method. So if you do become pregnant, but then you have to visit your healthcare provider as soon as possible, so that you can have a very accurate information about what are the options that are available in order to take care of your body and also the health of your baby. So you should know that you have this right to have an idea about the pregnancy care, which include antenatal care and the postnatal care. So antenatal care means the care that you get when you are planning to get pregnant and during the period of your pregnancy. And the postnatal care mainly include when you delivered your baby and now it's a phase where your body is recovering and going back to the normal stage, and also the care which is provided to your children. So these things are also included in the sexual health, and you should have a very good idea about how your body is functioning during the pregnancy period and what are the changes that comes, and how you should be aware in order to prevent your health from getting deteriorated, right? So another, next slide. So another stage of our life is menopause. Next one. Next. Next. So yeah, so menopause. Uh, menopause, from this word we can see is an stop or the end of your menstruation cycle, right? So these are the topic which we normally don't discuss in our day-to-day life practice. So usually our the age group of 45 to 55, these category of women are normally facing the menopause. It's a point in time where women experience the last period. So during this time, normally the female group of population, they are not knowing what is happening to their body. So for the certain age group, for certain period of time, your body is releasing hormone. There is this menstruation happening. You are getting married, you are having babies, you are pregnant. So all of this physiological process is happening, and all of sudden, as the particular age of like 45 or 50 or 55, your body start to change. So your body start to change, your menstruation is irregular, you are not having regular bleeding, or you are facing some changes in your body, but you don't know what's happening. So it usually, our mother, they are usually facing this problem, but since they don't have access to such education, they are not knowing what's happening inside their body, and they are panicking about the scenario. So 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 now, if I say what are the symptoms that women from these age group people might face, then you do have idea, then you can go and tell your mother. So if you are facing these sort of symptoms, that is completely normal. It's because your hormone are being increased or decreased inside your body. That's why you are facing such problem. So it include hot flashes. So hot flashes means that your body is being hot all of sudden. In one moment you are feeling so hot and chilling, and and another time you are feeling chills, you're feeling cold. So these are the symptoms. Can you move to the next slide? So what are the symptoms that you can see in menopause? Are like hot flashes, chills, you are feeling cold, you're feeling hot, so it's changing, and you are having irregular periods. You are also having problems with your sleep. Previously you could sleep very easily, but now you are having problem with your sleep. Your skin, start to get dry because there are not enough hormone being produced inside your body. Your hair starts to fall, and there are vaginal dryness, and there are certain mood disorder, there's changes, sometimes you get angry, sometimes you get happy. So these are all the changes, but female, but women, they are not knowing what's exactly happening inside their body. So they might go to the menopausal depression stage. So once we are aware about these things, we can easily educate our mother or our aunt or the women of same age group living in our society, our neighbors. We can teach them that these symptoms are normal. It's just that you are facing these sort of problems because of the hormonal changes that is going inside our body, right? So if you see, when you are facing some such symptoms, is it necessary to go under some medication or not? So what the gynecologist, they mainly say, since it's a very normal physiological natural process, until and unless it's severely affecting your body, you don't need to go through any under medications. But how you can deal with this? You can have a very good um, health lifestyle, like having very healthy food, doing exercise, and doing meditation. Sorry about that, doing meditation, so that you can get focused. Next slide, please. So you can get focused about your life and know that all this process are normal and natural. You will be fine after some time. And also during this time, we as a family members should support each other. uh, um, and also, if you are severely feeling something low or high, you can get help from your medical um, center, have an idea about it from the medical expert, right? So if we see the changes of our body starting from menarche, which is the first time when your menstruation gets started, then the continuation phase of your menstruation, where there will be different changes, sometimes heavy bleeding or low bleeding or the cramps, and then you getting married, or your idea of getting pregnant or abortions, and then going through the menopause, um, and having idea about what are the options you have as a contraceptive device. So these all are the things you need to know during the different course as a female, starting from your childhood to the adolescence, then from early 20s to mid 20s, then late 20s, then 30s, then afterward during the menopause time as well. So if you have an idea about these things, and if you don't shy away from talking about these things, it can really help you as an individual, as well as you can help your other family members to know that it's how these things are benefiting you in terms of an individual. So you should talk more about these things, so that a lot of health hazard which is happening in our countries, like keeping the female population inside the cow shed or goat shed just because they are bleeding inside their body. It's a very normal physiological process, but since those group of people, they don't have a very much good idea about these things, they are keeping their daughter or their mother inside the cow shed, thinking that it's a kind of impurities they are facing. But in return, these are having an hazardous condition to them, and then they are getting infected with different disease, and then how it's hampering their health. So um, next slide, please. So um, next slide. um, Okay, I think that's the end of the slide. Okay, so how all of this together, it's not benefiting single individual, but it's also benefiting a couple, right? And a couple, and in return, it's benefiting a whole family and then certain community, and in at last a whole country and the whole world. How these education is uplifting the state of female health, and how much this is important, so that they can also live in very normal life with all the physiological changes that is happening, and also they can raise their voice against the discrimination or against the assault they are facing in day to day basis, just because their body is little bit different from a man. um, So we should be aware, and we should raise our voice when you think your body is being hampered, or you are being assaulted, or you are going through certain kind of violence, or you are being a victim of when you are being a sexual victim. And you can prevent yourself, you can prevent your mother, you can prevent your daughter or friends, or your neighbors. And you can always share such kind of information with people around, and be responsible citizens. So these are the topic that I have included in my presentation. I'm sorry I couldn't prepare in a very formative state because of my duties. I hope you all have a very little idea about what sexual health and why it is very important for women. And any other extra queries you have, and or any curiosities regarding the medication or anything, if you have any queries, please do ask me. I would be more than happy to answer your questions. Thank you so much.
Thank you, Dr. Sima. Thank you so much for all the information. I'm looking at the chat box. There is no one with any questions. If you have any questions and you don't want to ask them now, you can always send me an email, and then I'll forward all your questions to Dr. Sima. Anybody has any questions that you want to ask about your health? No? Okay, so I'm gonna email you the slides and the recording so you can watch it and you can share it with your sister, mom, friends who might benefit from knowing this. I know most of you are very young, so menopause is really far, and so but then I still recommend that share this information with your family members and everybody else who are dealing with this, because this is not something that we publicly will talk about. And all right, if you guys don't have any questions, I just want to thank all of you for being here. Let me stop the recording here.